Hello, I'm Rebecca Price from Ellipse Technologies, and today we're going to go through the distraction technique. The key purpose of this video is to identify the equipment that is needed in order to perform a successful distraction, to run through our standard distraction technique, but also to look at some alternative positions that we can utilise if a patient isn't distracting. So now we're going to go through the equipment that is needed in order to perform a distraction. First of all, we need to have an outpatient clinic table which is completely flat. We need the ERC, which is the external remote controller, which is the piece of equipment that actually performs the distraction. We need the Magec wand, which is the small handheld magnet locator, and some form of dark felt tip pen. It's important to use a felt tip pen rather than a ballpoint pen. First of all, it's much more easy to mark the skin with this, and it's also much more comfortable for the child. The last piece of equipment that is crucial for a successful distraction is a simple pillow. The importance of this is because by putting it underneath the part of the spine that is being braced by the Magec rods, you're actually placing the patient into a degree of flexion and thus offloading the rods. If it is placed too distally, it will force the lumbar spine into a degree of lordosis. Alternatively, if it's placed too proximally, it will push the head up and will actually put a down force through the rods. So now we've established the key ingredients that are necessary in order to carry out a successful distraction. We are now going to go through that process in detail. Okay, so hi Boston. Today we're going to just go through your distraction technique with you. So this is the ERC machine that we're going to do the distraction with today. You'll basically have two large magnets which turn, and as they turn, the rod in your back grows with it. So on the machine you have a green button and a yellow button. The green button is to distract the rod and the yellow button is to retract the rod, but today we're just going to be using the green button to distract. Okay, so just so that you know what the machine sounds like and not to be scared, we're going to press the green button. The noise you can hear is just the sound of the two magnets turning, so it's nothing to be scared about, and you're not going to feel anything, there's going to be no pain. So if you want just to have a little feel, and it's got a smiley face on the back. Okay. Okay, so in order to get a successful distraction, it's really important that the child is lying flat on the bed with a pillow underneath his torso, with his head lying to one side, nice and relaxed, with his arms lying parallel to his sides or lying over the bed. This makes sure that the rods are offloaded and that there's no restriction put on the spine whilst we're doing the distraction process. This is what we call our traditional position, and 9 times out of 10 this is the technique that you would use to distract all patients. The model here mimics what is happening inside the patient's spine. As you can see, we have the two Magec rods sat by side. Using this model, I'm going to show how you locate the magnets on the rod and mark with the pen. So using the Magec wand, you wave the Magec wand over the spine until you find the connection on the skin and you mark with a pen. On the standard rod, this is going to be at the bottom of the actuator, and on the offset rod, the magnet's going to be at the top of the actuator. So now we're going to locate the magnets inside the spine underneath the skin. So using the Magec wand, holding the handle at the end of the wand with the dimples, we're going to stroke this over the skin until we find the exact position of the magnet underneath the skin and mark with a pen. We now repeat this process on the other side to locate the offset rod. And again, we're going to mark with a pen. So once you've located the exact position of the magnets inside the rods underneath the skin, we're now going to line up the ERC with those magnets in order to do the distraction. As you can see, on the ERC, there is a small window which is sat in between the two magnets which are going to perform the distraction. This is where we line up the magnet location pen mark on the skin between that window. So placing the ERC gently on top of the skin, making sure that you have a good contact with the base of the ERC, but not putting on too much pressure. We're locating the pen mark between those two magnets in that window. It's crucial that the arrow is pointed towards the patient's head and that the ERC is sat square on the patient and not at any angle. Now the ERC is in the correct position, it's really important to explain to the patient that it's important for them to stay still and calm and relax throughout the process. At this point, it's important for the parent just to comfort and reassure the child that this is not going to hurt and it's going to be a very quick process. So now that the child is still and the ERC is in the correct position, we're now ready to perform the distraction. So pressing the green button, keeping your finger down continuously, we start the distraction. The noise that you can hear is purely the sound of the two rotating magnets turning against each other. The ERC goes up in 0.1 millimetre increments, so it's important that the surgeon keeps an eye on his distraction that he has. So for this process we've stopped at 3 millimetres, and as you can see on the screen it reads 3 millimetres. We're now going to repeat this process on the left hand rod. So lining up the pen mark through the window, placing the ERC on the skin, we're going to then press the green distraction button. It's really important that if the child starts to move during the distraction process, that you just calm them back down, make sure that they're nice and still again, and then start again. The machine will record at what point you've stopped, and then you can just start the distraction up again. If the patient does move and wriggle throughout the process, then the machine reading and actually what might be happening in the rod might be different. So it is very important that the child stays as still as possible. So always just get the parent just to calm them down again, get them to lie flat, and then we'll continue with the process. During the distraction, the patient won't experience any pain. They may feel a bit of a funny sensation, which is the magnet inside the rod turning underneath the skin, but there won't be actually any pain. However, what we do suggest is that just to explain to the child, if they are experiencing any pain, that they just let us know. You can stop the process and then restart when the child is calm again. So today we successfully distracted the patient by 3 millimetres on either rod. It's now important that we just verify that distraction using either ultrasound or X-ray to ensure that the 3 millimetres that was shown on the machine has been translated into actual distraction on the rods inside the patient. In most patients, using the standard prone technique of lying the patient on their front is the successful method to which to do the distraction. However, in some patients, we find that due to the curve of their spine, we have to utilise other positions in order to offset the rod to allow for distraction. So this is another position that we can utilise. Lying the patient in a fetal position with his legs tucked up to his tummy as far as possible, utilising the pillow underneath his spine to add a bit of fulcrum bend to his position, and then tucking his head in towards his parent. We can then use the magic wand in exactly the same way to locate the magnets in his spine and mark with the marker pen. So once you've located the magnets under the skin, as you would with the normal process, you then carry out your distraction as normal. This is easy on the top rod. However, on the bottom rod, due to the fact that the table and the pillow is in position, you sometimes need to tilt the ERC up onto one magnet in order to get close enough to the spine to do the distraction. This is a useful position to utilise if you're having problems distracting one of the rods. For example, if it is the right-hand rod that is not distracting, by placing him on the left-hand side over a slight fulcrum bend of the pillow, you're offloading that right-hand rod and allowing the rod to distract successfully. Alternatively, if it is the left-hand rod that you're having problems distracting, place him on the right-hand side over a fulcrum bend and distract the left rod accordingly. The fetal position is also useful to utilise if a child is wheelchair bound, because they often have constrictors in the muscles of their legs, which means that they can't lie completely flat. So putting them on their side in the fetal position is often a much more comfortable position for them to be distracted in. This is another position which is useful to utilise if you're having problems distracting the rod, because the child is hugging the pillow and offloading the rods by going into a degree of flexion. It's important that there's a pillow here to make him comfortable and ensure that parent or nurse is stood the other side of them to ensure that they don't roll or fall off the bed. In this position, it's extremely easy to locate the magnets under the skin and carry out the distraction in exactly the same process. So another position that we can use in order to carry out the distraction is by actually sitting the child on the parent's lap. This is particularly useful if the child is very nervous and needs some comfort, and also for children who are mentally challenged and find the process extremely stressful. Also, they can put their arms around mum's shoulders and mum can hold under the armpits, and this actually offers a bit of offloading of the rods inside the spine, and it also means that the child is nice and calm and comforted by the parent whilst the surgeon carries out the distraction. Another position which is useful to utilise when distracting the rod is to ask the patient to lie over the edge of the table. By placing the child in this position, we're actually offloading the spine by putting them into a degree of flexion. So the rods are offloaded, and also the weight of the child's pelvis hanging off the table adds a bit of traction to his spine, which makes it easier for the rods to distract. And in this position, you basically repeat the same process that you would for the other positions. With patients with a stiffer curve, it's often useful to actually apply a little bit of manual traction through the spine. So we ask a parent or a nurse to hold onto the ankles and just to pull gently whilst the distraction process is occurring. The patient holds onto the edge of the bed. The surgeon places the ERC onto the spine as normal, and just before they carry out the distraction, the parent or the nurse just puts a bit of pulling force through the ankles in order to add some traction to the spine. The distraction is then carried out as normal. In a stalling rod, it is sometimes possible to generate more force and further distraction by utilising this technique. The ERC is positioned above each device magnet and repeatedly activated to incrementally increase distraction force. Laboratory testing suggests that distraction force can be increased by as much as 15 to 20% with repeated alternating activations. It is important to understand that at some surgeon visits a distraction of the Magec rods may not be achieved. It is key to manage the surgeon and patient's expectation and to educate them on the causes of this. Firstly, if Magec rods are distracted too soon after surgery, the rods may still be under a high tension force following the surgeon's manual distraction. In this scenario, it is important to wait 3 months post-surgery for the patient to grow and also to give the anchor points time to solidify. Secondly, throughout a patient's experience with Magec, it is not unusual to go through a period of time where the rods do not distract. This is usually because the child is not growing. Keeping a record of sitting and standing heights of the patient will allow you to identify if this is the cause. We have experience of Magec rods going up to 9 months before distracting again, and this can occur at any time during the treatment programme and rectifies as the child starts to grow again. Thirdly, in some cases, Magec rod patients gain weight throughout their treatment programme. This means that the increased soft tissues result in a greater distance between the rod magnet and the ERC, resulting in lower forces being generated, which can, in extreme cases, lead to rods not distracting. It is important that surgeons monitor patient weight gain and are mindful that certain syndromes, such as Prader-Willi, can cause dramatic weight gain that will interfere with the coupling between the Magec rods and the ERC. And finally, it is important to note that if you have utilised all of the patient positioning techniques that we have gone through on this video and have taken into consideration the above points, and the rods are still not distracting, it is important to contact Magec as soon as possible for assistance and support. Thank you for watching this video. I hope that it has equipped you with all the tools necessary in order to ensure a successful treatment programme for your patients with the Magec growth rods. If you have any further questions, don't hesitate to contact Ellipse Technologies. Many thanks.